Hey guys, so I want to talk to you about a few things that I would definitely avoid doing in the first couple weeks to months postpartum, but I want to explain to you why. So our pelvic floor and our core work as a pressure system. There's a top, there's a bottom, and there's sides that go all the way around that support all the pressure in our abdominal region. After carrying a baby for 9 or more months and delivering a baby via C-section or vaginally, there's going to be some areas that are weak and some areas that might have more tightness. There's some muscular imbalances there. Now, pressure is going to move in the path of least resistance. So for example, if our pelvic floor is a little bit weak, then that pressure is going to go towards that path of least resistance. If maybe we have some weakness in the front of the stomach here, then that pressure is going to press out on that part of the stomach. So the reason I'm advising for most women to not do these exercises is because if we don't know how to correctly manage that pressure, then it's gonna go to that path of least resistance, which can lead to pelvic floor dysfunction and issues later on. It can also make it a lot harder for your body to recover because we are putting strain on muscles that are not ready for that activity. Now, I will preface by saying that this is not for every single woman. Some women can go right back to running and all their exercises without any dysfunction because they are properly able to engage their core and their pelvic floor at the same time to safely manage that pressure. So let's take a look at some of those exercises to avoid. Burpees, traditional ab workouts like V-ups, knee-ups, and leg lifts, cycling, whether we're in a seated or standing position, max effort lifting, running, jogging in place, and swimming. You might be wondering what pelvic floor symptoms I'm talking about, and those are things like the feeling that something's falling out, discomfort or pain in your abdomen or pelvic floor, especially on your C-section scar if you feel any tearing there. If you notice that some of your exercises that you're doing is causing more bleeding. It can also look like discomfort or pain during intercourse as well. So we want to be careful that we're making sure that we're paying attention to these symptoms. So one thing we definitely do not want to do is guess on what is and is not safe. We want to be paying attention to our body and listening to those symptoms and checking in with that pressure. So some things you might want to look out for is coning or doming of your abdomen. If you're doing an exercise and you notice that there just kind of seems to be like a bulge coming out in the front here. If you feel any of that heaviness in your pelvic floor region, if you're having any pain, discomfort, or tearing, or even incontinence, if you're having a hard time holding in your urine while doing some exercises. Those are all signs and symptoms that we do not want to be ignoring. If you would like more guidance in those first 6 to 8 weeks postpartum, you know that your body is going to be aching for some type of movement and mobility to help get the blood flowing and promote healing and recovery, then I have a postpartum movement guide that would be perfect for you. I go through some breathing activities that will help engage in a safe way your pelvic floor and help promote that healing. Some exercises for your shoulders so that we don't get stiff in this rounded position while we are breast or bottle feeding our baby. And some exercises start engaging our glutes as well. All the musculature around our glutes and our inner thighs here, those also connect to our pelvis, are important pieces to the puzzle when we're looking at the pelvic floor musculature. So again, if you're interested in a little bit more guidance, from the point of labor and delivery to the point that you see your OB and return to normal exercise, this would be a great guide for you. Lastly, I also have a postpartum program that was specifically designed for women who are anywhere from 6 to 8 weeks postpartum, just returning to exercise, or if you're postpartum and you just never address the pelvic floor musculature and want to strengthen and support your body in that way, I have a perfect program for you called the Postpartum Program. It's a 12-week program, and it bridges the gap between rehab for the pelvic floor and getting full body strength workouts in a safe manner so that we're not just running back into the gym and injuring our pelvic floor even further.